Hi, Janet.
Hi.
So I am Karen Out, and I'm interviewing Janet Rhodes today with Rhodes to Wellness. And Janet, I understand you're a trauma therapist, and beyond that, you do some equine trauma therapy.
Yeah,
And can
yeah,
you tell me a little more about your practice?
sure, you bet. Um, so I first trained in two trauma healing modalities through the Center for Healing, and it was root cause therapy and embodied processing. And then, which are very body-based therapies, um, different than what we see in Western medicine. So Western medicine is very much focused on the mind and our cognitive thinking, and there's a lot of talk therapy involved. And we it kind of doesn't connect with what's happening in the body. Um, but when we go through trauma, what is often affected? We feel it in our body, right? Um, we feel the fear, we feel the pain. And so that needs attention as well, I believe, for real healing to happen. So these two therapies are bottom up approaches. So you're focusing more on the body. There is some talk therapy involved, but it's more focusing on the sensations within the body, going to the root cause of your traumas and releasing any stored emotions or energies from those, and that's when healing actually happens.
So, is that a typical symptom of trauma that you would become disconnected from what you're feeling in your body?
Yes, it can be very common because if if someone becomes traumatized, often they're not able to fully release all the energy and emotion at the time of the event. So perhaps they were a child and it wasn't safe to release the fear or the sadness that they were feeling because maybe the adult in the room didn't make that something that could happen. Or maybe, you're in a stressful situation at work, so you can't fully express how you're feeling because your boss is getting upset at you or you're getting fired or something. So that energy gets stored. Or you're in an abusive relationship and you just have to keep swallowing it back down, right? You can't express what's actually really happening. So that energy gets stored. You kind of disconnect from yourself to protect yourself. Our body and our mind can do that naturally to protect ourselves. But what that can end up doing is leading further to other health concerns. So then we start feeling anxiety, we start feeling depression, we start having trouble focusing um, because of all this disconnect. So with these therapies, we're gently coming back into the body and exploring those sensations and letting you finally feel and release them.
So those two modalities are a little different than the equine. Is that right?
Yes, yes, they are. The equine, something very close to my heart. I have been a horse girl since I was 4 years old. My cousin got a pony, was terrified. I wasn't. I used to ride the pony, and from there, it didn't stop. So I've always had horses in my life. They have helped me through some very dark times of my own, where I was battling depression and anxiety and post-trauma stress. So when I started getting into this training of helping others, I also wanted to bring horses into my business because I knew that they had that energy level and that healing power within them. And I wanted others to experience that as well. So I did my equine facilitated learning training from with Equimotional, which is out of the UK. And we partner with the horses, um, and they help a person, with managing emotion, gaining self-confidence, improving their self-esteem. We can go over consent and boundaries, and they help improve a person's mental well-being holistically. And I really enjoy that work, bringing that to people, and I bring that to both adults and children.
That's beautiful. And
Yeah.
what kind of training do the horses go through to become therapists?
Well, they don't go to school. Yeah. But a lot of horses are very intuitive as it is, because when they are in the wild or in a herd, they're very in tune to the other horses around them because that's survival, right? that aids to their survival. So they can hear a human heartbeat from 4 feet away. So they can pick up on what, the speed of our heart, they can pick up on our energy level. So they're very in tune with that. And can sometimes show you parts of yourself that you don't want to see as a result. But they can, I see those as times to learn for what we need to still deal with. And, but they can also be very comforting as well.
That's amazing. And do you have any success stories from clients that you'd like to share?
For sure. The root cause therapy I find is I've had some great success stories with that. It's been really helpful with people battling, addiction or anxiety. And I've had clients before that have been heavily using drugs because they're also dealing with post-traumatic stress, right? And
Sure.
so when you get into post-traumatic stress, you want your nervous system to calm down. You want to feel whole and safe again, but your nervous system is still stuck on. So what can happen is we start using in order to bring that nervous system back down. And so for a little while you're using the drugs, you feel okay again. You feel normal, right? And so that's where the addiction kicks in. But that's got its own problems that come with it, right? So I've had clients that have been heavily involved in addiction, and after 4 sessions with root cause therapy, they don't even want to use anymore. They don't have the
Amazing.
urge. They're just like, nope, I'm good. And yeah, and I follow up with them, and 6 months later, they're still feeling okay. And so it's really amazing work.
So it sounds like maybe your clients leave eventually because they're getting so much better.
Yeah, eventually, I do a lot of follow-up, and we can always have follow-up sessions, but yeah, a lot of them, yeah, it really turns around for them.
So is it just mostly primarily post-traumatic stress that you work with and addiction?
Yes, but also anxiety and depression. They're
Yeah.
all trauma responses.
Mm-hmm.
And anxiety is so huge in our world nowadays. So I definitely have a lot of clients who deal with anxiety. Absolutely.
Do you think it's increased in the past few years as
Oh,
the general population?
yes, I think COVID definitely helped increase anxiety. It was definitely a part of that, right? We all were caught up in we can't go outside, we can't be with our family, we might get sick. So that increased a person's fear level and increased anxiety as well. Also, I see that we live in a world that's constant, right? It's go, 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 instant response. And with our phones, and the average human being now only has a focus of about, what is it, 2 minutes, and then they switch off onto something else, right? And we have these social medias that we're constantly, we're scrolling, right? We just scroll along, and so our focus is off, which is increasing our anxiety as well.
Mm. And do
Yeah.
you have a particular age group that you work with, or is this therapy appropriate for or inappropriate for anyone?
The equine program is good for any age. So I work with children and adults. The root cause therapy and body processing, because of what's involved there, it's for adults.
Sure.
I don't do that with children, but yeah, so there's a little bit for everybody.
Well, and children are so intuitive, they probably get a lot
Yes,
out of that equine therapy.
they do. They absolutely do. Yeah.
And where are you located? How do people come and see you or come and
Just
find you for either in
great.
person or online?
I live in Saskatchewan, Canada. So I'm in the middle of Canada, if you're not familiar with it. I live in the prairies. Um, and people can find me online. I do have a Facebook page, Rhodes to Wellness Rhodes to Wellness Coaching, sorry. And Rhodes is RHODES. My, and I also have rhodes to wellness.com. That's my website. that those would be the two best ways to reach me.
That's great. Well, I think you're making a big difference in the world, opening up new pathways to healing trauma that aren't available through traditional means. And I think that's an important mission to have in this life.
Yes, I agree. Absolutely.
Well, did you want to add anything else today, Janet, or are you feeling complete?
I think we covered everything. Yeah, feels
Great.
good.
Well,
Thank you
thanks
so
so
much,
much.
Karen.
Thank you for
Okay.
your time today, and look forward to talking again soon.
Okay, take care.
Okay, you too.
Bye-bye.
Bye-bye.